My name is Oscar Olima, County Secretary and Head of County Public Service in Migori County. I am here today together with my colleagues in the Department of Health, but more importantly, we are joined in this day by our partners with whom we work to support health services in Migori County, and there are quite a number of them standing here with me. The occasion that we had this morning and going into this afternoon was the occasion of the launch of our health sector strategic and investment plan to cover the period of 2024 to the year 2028. Not just that, but we have launched a total of 7 documents today. Each of them addresses a specific sector in the health sector, and we hope that in the launch of these documents we will have a health sector that is well fortified with adequate plans, adequate arrangements, and together with these partners with whom we stand here today, we will see to it that healthcare in Migori County to the people of Migori is improved, just like we have tried to do in the past few years. The documents that we launched today, if I may mention them by name, is the Health Sector Strategic Investment Plan 2024-2028, the Birth Companion and Inclusion Strategy, the Data Quality Protocol, End-Term Evaluation Report that addresses Adolescent Multisectoral Action Plan, also the Migori County HPT Supply Chain Plan 2024, among others. Yes. No, these areas, just like the name suggests, is the strategic and investment plan. Basically, it highlights the areas that we feel need augmentation and additional support, and how to finance the support. As you may know, health is one of those areas that is fully devolved. But as a county government, we only receive about 15% of from the national kitty. It means that the rest of the percentage remains at the national level. And it's for that reason that we rely heavily on the support by these partners, who include CHEB, USAID, and others, with whom we will introduce themselves to augment and supplement the efforts that we make as a county government. Left by ourselves, the budget that we have will have serious deficiencies. And that's why we hold dear our friendship and partnership. And our governor stresses all the time the need to embrace and work continuously with these partners by meeting the requirements that they set and by creating a conducive environment as government for the partners to operate together with us in the health sector. We are also joined in this day by the Health Committee led by the Chair in the County Assembly of Migori and other members. As you know, it's a tripartite arrangement where the legislative arm of government does the legislation, and then the executive implements. Then they come back and do oversight. So we work together as one machine that helps deliver in the health sector for the benefit of the people of Migori. On-source revenue countrywide is a challenge to many governments, and automation is just one of those measures that we as a government are trying to put in place to help us improve on-source revenue collection. But as anyone will tell you, just automation alone or revenue policing is not enough. At the center of the success of any process is the people. So we as the government are investing and relying on our people to actually get the job done. Either if you do automation, you do revenue policing, you do revenue monitoring, if the people factor is not taken care of, you may not succeed much. So yes, we are automating. We have partnered with Safaricom to that end, but we are doing a more people-centric approach towards revenue collection.
I think this is a very good day, especially for Luala, having contributed very significantly to these documents, especially the Migori Health Sector Strategic Plan and Investment Plan. providing a roadmap, especially on health financing, which has been an issue in the county. And we know very well that the resources have been dwindling. And so this is a guide and a roadmap that would be very key, both for private partners and for public partners, to see how to invest in that particular document as we join hands in helping the county deliver on its mandate. Another key document for Luala is the TBA Inclusion Strategy document. That is very key because this is a group of people that we cannot ignore. They live within us, they live amongst us, and they have contributed to either good indicators or poor indicators. And you know, maternal health indicators have not been doing very well, as much as we've made significant progress in the county, but we still need these TBAs, the traditional birth attendants, to be included in the formal health system. So these are documents that will help us and even guide us as partners to work together with the Migori County Health Government to ensure that everybody is included, because this journey is not a journey that one can walk alone. It needs all our minds, including the public sector, including everybody else. I'll not talk about all the other documents, but this is a very great moment for Luala. We celebrate the county, we celebrate the launching of these documents, and we hope that after this, we will see a roadmap that is very clear for coordination and collaboration amongst us. Thank you very much.
I want to say that as a department today, we are really glad and happy to have launched the 6 documents, which are going to be very key in our department to deliver universal health coverage, which is a national objective and also a county objective. I want to say that as a Department of Health, these documents, just as it has been said, would help us even in planning for infrastructural improvement. They will help us even in planning for staffing, which has been a challenge to us. It will also help us even mitigating some of the issues which affect us as a department. I want to particularly talk about the document about the adolescents. We have the triple threat, which has been affecting the adolescents, where we have the teenage pregnancies, HIV infection, and even the sexual gender-based violence. And as a department, I want to really thank our partners whom we are going to work with along, so that we ensure that whatever is in these documents is implemented for the betterment of improvement of our health delivery and also for the benefit of the people of Migori County. Thank you so much. I want to say that the document gives us a roadmap on financing, and as you are all aware, whenever we have pharmaceutical products brought to our department for use, there are things which are consumed, both pharmaceutical and non-pharmaceutical products. We can't say that at per se we don't have them in our facilities. We have them, and if at all there is inadequacy, there are things which we are going to sort out, and already we have procured them, and very soon we are going to distribute them to all our health facilities within the county.
Where is Migori County in terms of SHA registration?
Currently, we are at 13% in terms of registration, and we have put modalities in all our sub-counties. We are also going to use our CHPs in our community units so that each and every household is reached for us to improve on that percentage which we have already registered. And as you are all aware, SHA is the way to go. It would help our people get health delivery of service in their households. It will also help them to get treated in our various primary health facilities, and therefore we have made strategies to improve on that registration, which stands at 13% currently.
National level, in their request, made a request to the National Treasury. Their overall request for the 2024-25 financial year was 3 or 4 billion shillings. They only got 127, which means there was a big deficit. When they get a deficit at the national level, it also affects us as counties because we rely on our share of the national capitation. But as we say, we are making adjustments, and we are working closely with the partners that we have to ensure that deficit does not affect the provision of services. Thank you.